Okay, so Assalamu alaikum everyone. My name is Dr. Batul Zahra, and today, in partnership with Medical Hub Academy, I'm going to give the lecture on the topic adrenergic antagonist, which is also known as sympatholytics. So, as we have discussed in the last lecture, that sympathomimetics are the drug which mimics the action of sympathetic system. Sympatholytics actually work in the reverse, right? So that's why they're called as sympatholytic, because they block or decrease the effects of sympathetic nervous stimulation, endogenous catecholamines, and adrenergic drugs. So guys, over here, you can see that there are two types of anti-adrenergic drugs. So obviously, as we have studied in the last class, that there are alpha receptors and beta receptors on the prosynaptic membrane. So when we study about the adrenergic antagonist, obviously the drugs will be going to working on both receptors. So drugs which are going to be alpha antagonists are again two types. They are either the selective alpha blockers or non-selective alpha blockers. So when we study about the selective alpha and non-selective alpha blockers, we can see over here that there are two types of drugs which are non-selective, and they are phentolamine and phenoxybenzamine. And when you talk about the alpha-1 antagonists, which are selectively working on only alpha-1, these are doxazosin, prazosin, terazosin, and tamsulosin. Over here, we can easily remember the suffix "sin", and whenever the suffix "sin" comes in any drugs, we can recognize that these are selective alpha-1 blockers. So we have doxazosin, prazosin, terazosin, and tamsulosin. Now, first of all, we're going to study our selective alpha blocker, which is prazosin, and it is a selective alpha-1 adrenergic blocker, and it helps to reduce the blood pressure. So obviously, we're going to work in hypertension by dilating the arterioles and veins, and it also relaxes the smooth muscle in bladder neck and prostatic capsule. Hence, we can use prazosin as a drug of choice for BPH, benign prostatic hyperplasia. So we can remember that prazosin is the drug for hypertension, right? As well as benign prostatic hyperplasia, right? Okay, now, so again, the side effects of prazosin are the same, same side effects which an alpha blocker will going to cause, which we have already studied in the previous slides, is the orthostatic hypertension, reflex tachycardia, inhibition of ejaculation, and nasal congestion. Now, over here, you can also see that the prazosin is also notoriously known for first dose effect. So we should be knowing that what is first dose effect. The first dose phenomenon is basically a sudden and severe fall in blood pressure that can occur when changing from lying to a standing position the first time that an alpha blocker is used, right? So when we are going to use the prazosin, so there will be a postural hypertension, and this usually happens shortly after the first dose is absorbed into the blood and can result into fainting. And this syncope mostly occurs in 1% of patients. So loss of consciousness is about 30 to 60 minutes after receiving the first dose of prazosin. And yes, as I've told you before, that it will result in severe postural hypertension, And it can be minimized by using the small initial doses like 1 milligram or less. And when we're going to begin the treatment, we will ask, in fact, we will gonna want the patient to avoid driving and other hazardous activities like using some kind of dangerous machinery for 12 to 24 hours. And we usually gonna administer the drug, especially the initial dose at that time. Now the next, we have phentolamine. And as we have studied in the previous slide, that phentolamine and phenoxybenzamine are the non-selective alpha blockers. So obviously we're going to work on alpha-1 and alpha-2 receptors. And it is the drug of choice in pheochromocytoma because in pheochromocytoma, there will be the tumor on adrenergic, on adrenal medulla. And if we're going to release a copious amount of epinephrine, so we can use it over there. And it also used to prevent tissue necrosis following the extravasation of drugs that produce alpha-1 mediated vasoconstriction. Now the adverse effects are just like prazosin, and it produces greater reflex tachycardia than prazosin due to alpha-2 blockage. And overdose can produce profound hypotension, and eventually it will going to elevate blood pressure because it's a non-selective blocker, so it will also work on norepinephrine. Now the clinical uses of phentolamine. Alpha-2 agonists are used for hypertension, therapies, epidural route for severe pain in cancer, and investigationally for anger management, alcohol withdrawal, postmenopausal hot flashes, ADHD in opioid withdrawal, and as an adjunct in anesthesia. So phentolamine is again going to be used for all of these conditions. So that's all about the adrenergic antagonist. And if you have any sort of question, please let me know. Thank you so much.